It's important to share the stories of healthcare professionals because sometimes the media paints a negative portrayal of the medical profession. I once wrote a column in USA Today talking about chronic pain management and how both doctors and chronic pain patients were in no-win situations. A few days later, there was a letter to the editor, and it read in part, "Doctors prescribe drugs so they can get to the golf course a little bit earlier." And I think comments like those are really unfortunate because all it does is feed into the stereotype of greedy doctors ordering unnecessary tests, driving up the cost of healthcare. I happen to think blaming doctors for systemic problems in our healthcare system isn't going to solve a thing because all that does is pit doctor against patient when they should be united in the common goal of improving our healthcare system. And it overshadows the stories of the majority of doctors who aren't in for the money and go that extra mile for patients. I was reading a newspaper article once where medicine residents were interviewed, and there was one resident who was 8 months pregnant and she was taking extra overnight call shifts for her colleagues. And she was asked, "Why are you doing this? You're about to give birth." And she said, "I feel guilty for taking my upcoming maternity leave. I'm doing extra call shifts now to pay back my colleagues who will be covering for me later on." And these are the stories that we need to share on social media and let the public know that doctors are human too. We need to share the epidemic of physician burnout, the challenges of practicing medicine while raising a family, and highlighting all the sacrifices everybody in healthcare makes to function in a system that stacks the deck against good patient care. And what these stories do is humanize healthcare professionals. It's a powerful way we can change the public perception of the medical profession.